Patient rights are not posters on the wall. Patient rights are actions at the bedside. When a patient enters a hospital, the patient brings not only a diagnosis but also dignity, expectations, fears, beliefs, questions, and rights. Nurses are among the closest professionals to the patient and therefore play a critical frontline role in protecting and promoting patient rights. The PRE chapter, Patient Rights and Education, focuses on protecting and promoting patient rights and family rights as well, informing them about their responsibilities, supporting informed decision making, providing understandable information and education, explaining expected cost, addressing feedback and complaints, and maintaining effective patient-centered communication. Patient rights. What nurses must protect? Respect, dignity, and non-discriminatory care. Privacy during examination, procedures, bathing, dressing, catheterization, and other intimate care. Confidentiality and appropriate protection of health information. Information about care in a language and manner the patient or family can understand. Participation in decision about care within applicable requirements, respect for individual values, beliefs, cultural needs and spiritual needs, protection from neglect and abuse, a safe mechanism to raise complaints or concerns without fear of retaliation, appropriate informed consent process for specified procedure or care. Patient responsibilities. What might be the patient responsibilities? What are the patient responsibilities should follow? What nurses should educate to the patients? Provide accurate and complete information about health history, allergies, medicines and previous treatment. Ask questions when information is not understood. Participate in agreed care and follow safety instructions. Respect healthcare workers, other patients and hospital property. Follow infection prevention, identification, visiting and other hospital safety requirements. Inform staff promptly about changes in conditions, concerns or adverse reactions. The nurse has a patient rights champion. Use the bedside sequence. Listen, explain, protect, escalate, document, monitor, improve. At admission, explain rights, responsibilities and grievance mechanisms as applicable. During care, protect privacy, dignity, confidentiality and respectful communication. During procedures, confirm that the required consent process is completed and concerns are escalated. During education, use a language and manner understood by the patient or family and verify understanding. When a concerns or violation is identified, listen, report, escalate through the defined mechanism and document. After complaints or incidents, support RCA root cause analysis, CAPA corrective and preventive actions and follow-up on effectiveness where assigned. What are the evidences may involve? For the rights and responsibilities, approved charter and policy. Current versions, display of those policies or patient rights and responsibilities and availability of those. For the patient awareness, admissions or education record, patient or family interview, education material should be available. During privacy and dignity, bedside observation, privacy audit, curtains, screens or draping. Confidentiality, record handling controls, staff training, audit or observations notes should be maintained for the confidentiality. For the information and education, patient education records should be available in the multilingual or appropriate IEC materials. Teach back, understanding checklist should be available. For the values, beliefs and cultural needs that you are following, for these assessment or documentation of preparation and care responses should be available. For the consents, approved consent forms completed and documented carefully and authenticated records and audit report must be available. Complaints or grievances Evidences should include complaint mechanism, register or system, response and closure records. Rights violations may include incident or complaint report, investigation, root cause analysis, corrective action and preventive action, and effectiveness reviews are the documentation evidences should include. Monitoring, for the continuous monitoring, PRE audit result, trends, dashboard or indicators, committee reviews should be available. For the continuous improvement, corrective actions, training, re-audit, leadership review and minutes of the record should be available as evidences. These are the few examples or evidences that should be available for the continuity and continuous care of the patient rights and responsibilities followed by the hospital. What an assessor may ask during the assessment to the nurse: what are the patient rights? Respect, dignity, privacy, confidentiality, information, participation, cultural or spiritual consideration, complaint mechanisms and other rights defined by the hospital is the answer. How do you educate patients about their rights? Your answer should be explain at admission or appropriate points, provide accessible information, document the process as required and verify understanding. What will you do if a patient complains about a rights violation? So what is your answer? Answer is listen respectfully, ensure immediate safety, inform, escalate through the defined mechanism, document and support investigation and corrective action and preventive actions evidences. How do you protect privacy? Use curtains, screens and appropriate draping, limit unnecessary exposure and conduct discussions or procedures privately. How do you protect confidentiality? Discuss information only with authorized persons, secure records and avoid inappropriate disclosure. How do you know the patient understood? Ask the patient or family to explain back key information or otherwise verify understanding using the hospital's approved method. Is displaying a patient rights charter alone sufficient? No. Evidence should show awareness, implementation, protection, reporting, monitoring and improvement. Evidences files, these are the suggested contents which I am telling you all. Patient rights and responsibilities, policy or charter, approved and controlled copy, display photographs and locations where applicable, patient or family education, formats and sample completed records, complaint or grievance mechanism and registers and system, rights violation, incident records, root cause analysis, corrective action, preventive action and effectiveness review, PRE, patient rights and education related nursing staff trained records, attendance and competency evidence, privacy, confidentiality and patient education audit and reports, patient feedback and patient experience results and trend analysis, quality or committee meetings minutes showing review and actions, re-audit and improvement evidence demonstrating closure and effectiveness. Protects more than a patient's health. A nurse protects the patient rights. Respect every patient, protect privacy, maintain confidentiality, explain care clearly, respect values and beliefs, support informed participation, listen to complaints, report rights violation, document correctly, learn and improve from every concerns. Dear nurses, you are often the professional who spends the longest time with the patient. You hear fears, see concern and notice changes that others may miss. If a patient does not know their rights, educate them. If privacy is at risk, protect it. If a patient is afraid to speak, create a safe environment. If a violation occurs, speak up and escalate. Patient rights and education is not merely a chapter for accreditation. It is a daily nursing responsibilities. NABH compliance becomes meaningful when the patient experiences dignity, privacy, information, safety, and a voice at the bedside. Every patient, every interaction, every procedure, every time. There will be another important area, that is patient report outcome measures and patient report experience measure. The video is separately available in the YouTube channel of mine. Please go through that, visit, understand and learn, implement and improve. Follow more hospital administration, quality, patient safety updates and for learning purpose. Thank you.